audible.
Okay. Not even now?
Sir, no, there is no clarity, sir.
Not enough of clarity? Now? Not even now. Even now you couldn't hear me clearly, no?
No, sir.
Okay, fine. I'll How about now? Is it clear now? Is my voice clear and audible?
Sir, your voice is very low, sir.
Now is it clear and audible now?
Still not, sir.
Not even now.
Sir, ikkada naku okay.
Fine.
Maybe problem with my system, I think. Sorry, sir.
Yes, ma'am.
Okay. Okay, fine. Thank you, sir. Thank you.
Good afternoon, everyone. I hope you all are doing well. As we come to the conclusion of this incredible one-week online National Faculty Development Program on merging technologies in pharmaceutics, integrating research with modern pedagogy, I'm filled with a sense of accomplishment and gratitude. This has been a truly enriching experience, and I'm sure we all are living with new insights and inspiration to apply in our teaching and research. Over the past week, we had the privilege to explore the advancements in pharmaceutics and understand how to blend these emerging technologies with modern teaching practices. The dedication and active participation from all of you have been absolutely heartwarming. Today, as we wrap up this successful journey, we have a special guest with us, someone who has played an important role in my own academic journey. It is an honor to welcome Dr. S. Nandakumar, Sir, Professor and Vice Principal, Dr. MGR Educational and Research Institute, Chennai. I now invite Mr. A. Ram Sudhir to give brief introduction about today's guest speaker.
Thank you, ma'am. Good afternoon, everyone. Myself, A. Ram Sudhir, Assistant Professor of Reddy College of Pharmaceutical Sciences. It is my pleasure to introduce our esteemed guest speaker, Dr. S. Nandakumar, sir, Principal, Vice Principal, Professor, Head of the Department of Pharmaceutics, Dr. MGR Educational Research Institute, Chennai. He holds a PhD from JNTU in 2019. SAR having 17 years of teaching experience and 12 years of research experience. SAR has published 20 national and 20 international papers in various high-impact journals. SAR has received many grants and awards in various events. We are honored to have Dr. S. Nandakumar, sir, to give a valuable insight today. Without further delay, let's welcome S. Nandakumar, sir, to take over the session.
Sir, Nandakumar, sir, please lead over the session.
Thank you. At the outset, first of all, I'm very much glad and privileged to give a presentation in this forum by CR Reddy College of Pharmacy. I thank the principal of the institution and the management for giving me this opportunity, and I also thank all the organizers who stood with me for a whole week. I first of all would like to record my apologies to all the participants as well as the organizers for not being able to do it on the stipulated time. because of my compelling medical reasons. So thanks for giving another opportunity for extending your the entire schedule of the program and giving me this opportunity to give my insights on the selected topic on this day. So with that note, I thank once again the organizers, and I would like to move on with my presentation. Organizers, with your kind permission, I would like to share my PowerPoint presentation.
Yes, sir, you can start, sir.
Please confirm me if it's clearly visible, so that I'll be able to move on.
Yes, sir.
Yes, sir, it is visible, sir.
And it is in full screen mode, right? Fine. Right. So thank you again, once again, to all the participants. So today I would like to discuss upon a topic on advances in nanoparticle-based drug delivery system. We all know about the nanoparticle drug delivery system, but the reason for choosing this particular topic is we are much aware of the type of nanoparticle system, but there are a few more aspects which we have to look upon when we are designing a nanoparticle system for research activity as well as to bring it to a clinical site. So that's what is the aim of my presentation today, which will more be focused upon the cellular aspects of nanoparticle drug delivery system. So this is Amulya. If at all any troubles, because since I am looking into my own PPT version, if there are any troubles, kindly let me know. I would stop and rectify whatever issues over there.
Okay, sir.
Thank you. So to start with, about 4 decades, the field of nanotechnology is growing very steadily, and there is no slowing down at all. And nanoparticle research as well as the field of nanotechnology has spread its wings everywhere in all possible fields of science. This application or the innovations which are related to nanotechnology has revolutionized everyday life. For example, in food industry, the nanotechnology has helped us to increase the shelf life of many food products. Thereby, it had influence upon our daily lives. And with regard to the medical field, the field of nanotechnology has enabled many of the poorly viable drugs to be absorbed better, many of the non-selective drugs to be targeted to particular area. We were able to get the diagnosis still more precisely. So that is what nanotechnology has done to the field of medicine also. Not only this, in other fields also. Let me talk here. To be very precise about a definition, nanotechnology is actually the manipulation of a particulate matter and reducing its size between 1 nanometer to 100 nanometer. Probably this size of the size in nanometers about a nanoparticle is a matter of debate, because in pharmaceutics or delivery systems, we don't keep it too stringent to 100 nanometers. We can even extend 500 nanometers, which we'll be discussing in the forthcoming parts of my presentation. But however, when it comes to quantum science, anything less than 100 nanometers generally produce properties which are uncharacteristic of the macromolecule of a material. That's why, when it comes to material science, they generally give the nanoparticle size between 1 nanometer to 100 nanometer. So what happens is these particles which are in the range of 1 nanometer to 100 nanometer, they have the capability to restabilize themselves, reassemble themselves. They can auto-stabilize and auto-assemble. And because of these properties of nanoparticles, they will be able to improve the function of many different aspects. For example, in terms of electronics, nanotechnology has helped us to make transistors which are much effective than the existing ones. Similarly, there are devices which are developed of nanoparticles which are capable of saving more energy and energy transmission also. But when it comes to biomedical science as well as delivery systems, the astounding importance of nanotechnology has been realized, and it had revolutionized the whole drug delivery system. So that is why we are going to focus, more on the nanoparticles and nanomaterials, which are actually have found their place, an inevitable place rather, in the field of medicine. So as I was, discussing, about the nanotechnology and its benefits. So we should also see why nanotechnology has taken up a very important place, and what is the problem with the existing devices or the existing systems that we already have in place. See, over a century, we had been using these conventional dosage forms, which are taken by oral route or parenteral or inhalations, and a number of delivery systems are available as tablets, capsules, syrups, and whatnot. So we have so many number of delivery systems. But what is the problem that is existing with the conventional drug delivery system is the question. Many a times these conventional drug delivery systems have the problem of poor solubility as well as poor bioavailability, and as a result we are unable to reap the complete benefit, therapeutic benefit of the drug. So this is the biggest problem that we have. Apart from that, these drugs are also poorly distributed, and they also damage some unaffected areas which are not to be where these drugs need not go. They go to those places also, and these drugs are also excreted very early, so they do not elicit the function they are intended to. So that's a major problem with conventional drug delivery systems. Here I would like to emphasize one thing. If according to Erlich Paul, we all heard this name as a faculty member. So the of magic bullet has got two important concepts. For a delivery system to be the most effective, there are two important properties that it should possess. The first one being the temporal release, wherein a delivery system should be able to release the drug in a rate controlled manner. So that's what temporal release talks about. The other aspect of a magic bullet or a very successful delivery system is the spatial placement. Means the delivery system should go and release the drug only in the area where we want it to. So two important aspects, that is the temporal release and the spatial placement, both are the key objectives of any delivery system. But the conventional drug delivery systems miserably fail when it comes to temporal release as well as in the spatial placement. They don't have the targeting ability. They also don't have the ability to release it according to the needs of the body. So as a result, I don't say that conventional drug delivery systems are a total failure, but what I'm trying to say, in cases where the drug specificity or drug selectivity to a particular organ is needed, conventional drug delivery systems may not help us. Maybe in normal ailments it's okay, but when we are targeting a drug, or when you are aiming to give a drug for a cancer or an inflammation in an interior organ, it's very difficult. We have to give it in the systemic circulation, and they go to all places, and all the healthy cells are also affected. So that's the biggest problem that we have with the conventional drug delivery system. And also they undergo enzymatic degradation. They don't stay very stable in different pH environments. So all these are the problems that are posed by the conventional drug delivery systems, and that's the reason. So we went to different kind of drug delivery systems called as the controlled drug delivery systems, where we have erodible materials, polymer matrix, degradable materials. We used so many. So these controlled drug delivery systems brought in a very big revolution in the way the drugs are given. The frequency was reduced, and the patients were able to take less number of doses. So it ultimately provided many advantages over the conventional drug delivery systems. But yet, these controlled drug delivery systems were able to fulfill the temporal release criteria of a successful drug delivery. But again, these delivery systems, controlled drug delivery systems, they were not able to specifically target a particular organ or a particular organelle of our cells. So that's where we had to rely upon the nanomedicine or the nanoparticulate drug delivery systems, which are capable of taking the drug, temporarily releasing the drug in the affected areas, and also targeted very specifically to a particular cell organ organelle. So that's why nanomedicine has come into the bright light, slightly shadowing over the controlled drug delivery systems and the conventional drug delivery systems. So if you look at the nanoparticles provide us a number of advantages over the other delivery systems or controlled drug delivery systems. To mention few, these, I mean, let me put that as a, I mean, first point itself. We are very selectively giving the drug to a particular part of the body, or very simply, we can have a targeted drug delivery. And apart from this, they also, I mean, increase the stability of your drug. They protect your drug against the biological system. They increase the shelf life of the drug. They increase the viability of the drug, and they, I mean, allow your drug to escape from the immune recognition. So they provide a number of advantages over the other delivery systems, and that's why, I mean, nanomedicine has, I mean, profoundly, I mean, gained the importance. If you look at, I mean, the number of publications that have come out in, I mean, with regard to the nanoparticles, it is so high in the last, I mean, 2 or 3 decades. It's because more of research are pouring into the nanomedicine because of the advantages that it provides. So here I have kept, I mean, a complete classification of colloidal drug delivery systems, wherein we have the particulate systems, the prodrugs, the vesicular systems, the conjugates, cellular carriers, supramolecular systems, and also the non-vesicular systems. So here we have a complete, I mean, classification of the drug delivery systems which are there. And to simplify it, I have given another, I mean, classification where we have the nanoparticulate drug delivery systems on. So here in the nanoparticulate drug delivery systems, for the sake of today's discussion, let us have the major, I mean, nanoparticulate drug delivery systems, which are the polymeric nanoparticles. Again, we can have multiple polymers, I mean, 2 or 3 polymers added together, so they are called as, I mean, paste. Then we have this, I mean, very famous lipid nanoparticles. We have most important liposomes, and we also have the second generation solid lipid nanoparticles, and tubosomes also coming up. Then we have the inorganic nanoparticles, where we have different types of metal nanoparticles. Hydrogen nanoparticles like DNA and RNA can also be used as the delivery systems. So in the first part of my discussion, I'm simply going to discuss in very brief about the different nanoparticulate drug delivery systems which we just discussed, not in very big details, but to the levels of basics, so that we will be able to focus more upon the biological interactions and other aspects of NPs. So to start with polymeric nanoparticles, we are all much aware of it. So here I have given a definition where the polymeric nanoparticles are particles which has got a size between 1 to 1000 nanometers, where 1000 being the extreme size for a nanoparticle. Though we don't try to develop nanoparticles of that size, as such, they become a very big failure. But in some cases, we can also have a bigger nanoparticle, but certainly not to 1000 nanometers. But for the sake of definition, anything between 1 to 1000 nanometers can be very well called as a nanoparticle. Okay, and these nanoparticles are generally loaded with a number of compounds, small molecules, or any type of drugs that you want to put in. But this nanoparticle terminology generally stands as a common terminology. We can have 2 different types of nanoparticles, nanocapsules and nanospheres, where nanocapsules are those in which the drug is exactly placed within the core or the lipid core, whereas the nanospheres are a matrix systems where the drug is interspaced between the polymeric matrix, and most times as the polymer erodes, the drugs, I mean, gets mixed. So the advantage of polymeric nanoparticles is that, I mean, they have the potential to release the drug in a very controlled manner, and they will be able to protect the drug against a number of environmental factors. They are capable of increasing the viability of the drug, and as a result of it, the therapeutic index of the drug also increases. So polymeric nanoparticles is one of the nanoparticulate drug delivery systems which is very extensively studied, and they are prepared by different methods. I have just kept a very I mean, simple summary of the different method of preparation and the polymers which are very commonly used. We are, I mean, most of us very well aware of these polymers: polymethacrylates, or epsilon caprolactone, polylactic acid, PLGA, or hydroxybutyrate, ethyl cellulose, even a number of natural polymers like albumin, casein, gelatin, alginate, chitosan as such. All these can be very well used for the preparation of polymeric nanoparticles. And Based upon the type of polymers that you choose, we have to choose the method of preparation. It can be a solvent evaporation technique or a nano precipitation technique or solvent diffusion technique, salting a technique. So the techniques that we use are not universal. It all depends upon what polymer that you are going to select, what kind of a drug that you have that you want to put inside the nanoparticulate carriers. Accordingly, we have to choose the method of preparation. So if the success of making a very efficient nanoparticle certainly depends upon the selection of the method, selection of the polymer, and the various formulation variables that are that are a part of the formula. So let me put it very simply. The solvent evaporation technique, I'm not going to the big details of how it is going to be prepared, but the reason behind inclusion of these slides is that most of the academic research generally focuses on lipid nanoparticles or polymeric nanoparticles. So I thought I will just give a glimpse of it. So for all the techniques that I'm going to discuss, at least 4 different methods, for all these techniques, the most important thing is we have an aqueous solution and we have an organic solution. So the organic solution generally comprises of the polymer and the drug. So most times we do that by that manner. But what kind of an organic solvent that we choose will differentiate the method with regard to polymeric nanoparticle preparation. With regard to this particular technique, solvent evaporation technique, so first of all, we take an organic solution, and this organic solution should be a polar organic solvent. So this polar organic solvent, is almost miscible with water. So what happens is anything like dichloromethane, it's not miscible, but it is more polar in nature. So chloroform or dichloromethane, these can be used. So in these organic solvents, we generally dissolve our polymer. Once the polymer is completely dissolved, the drug is also either dispersed or completely dissolved. So you dilute it and you will get a very clear organic solution. So this solution will act as the organic phase, and the aqueous phase we generally prepare using a surfactant. And this surfactant, most cases, polyvinyl alcohol can, or something like polaxamers can very well be used also. So what happens is, once these two solutions are ready, then we add the organic to the aqueous solution and we start sonicating it or homogenizing it in such a way that the nano droplets are formed. And after the nano droplets are formed, we can subject it to evaporation in a very slow phase, maybe about 24 hours. We put it in a stirrer and allow the organic solvent to evaporate, and as a result, nanoparticles are formed, which we further centrifuge, separated by different techniques, and put it for freeze drying to get your final nanoparticles. So, and with regard to the second method, which is the emulsion solvent diffusion technique. Here, the only important difference that we have to look upon is, here we use, here also we are going to prepare an O/W type of emulsion. So the solvent that is used here is a partially water miscible solvent. So this partially water miscible solvent should be previously saturated with water, and to this previously saturated solvent with water, we have to add the polymer and the drug. And similarly, we have to take an aqueous solution with a surfactant as in the previous case. So once these two solutions are ready, then we add this organic phase into the aqueous phase. We emulsify it by suitable homogenizing technique, and as a result, we get nanospheres here. So we will not be able to get the nano capsules by this method, but nanospheres will be produced. So possibly by this method, we will be able to produce nanoparticles which are between 100 to 800 nanometers. So that's the capability of this method. And the third method is the emulsification reverse salting out method, wherein here we have a water miscible solvent, and we are trying to reduce down the solvency of a particular organic solvent by addition of here a particular salt with which the organic solvent is not very much compatible. So this technique we use even for microencapsulation. So it's the same technique we use here also, but the solvent that we are going to take is the most important criteria. We have to take a water miscible solvent, and then slowly, after adding it to the aqueous phase, we slowly increase the concentration of the sorting out agent, which is magnesium chloride or calcium chloride or magnesium acetate. So these non-electrolytes are generally added. So once these non-electrolytes are added, the miscibility of the organic solvent, which is acetone, or acetone, since it is completely miscible with water, we can use acetone. So this miscibility of acetone will generally come down, and as a result, we will be able to produce O by W type of an emulsion. The rest of the process remains the same. Sorry, I'm going a little fast because this is not the major core of the presentation, but I just wanted to emphasize on all this. So the final technique is the nano precipitation technique. Here, so we use a solvent displacement method. We actually require two miscible solvents. The internal phase will consist of a polymer, which is dissolved in a miscible organic solvent. We can choose something like acetone or acetonitrile. So because of the immiscibility in water, they can be very easily removed by evaporation. That's the reason we. The principle of this technique is the interfacial deposition of the polymer takes place after the displacement of the organic solvent. So as a result, we will be able to get the nanoparticles very instantaneously because since it wants to avoid the water, it will immediately, just transform it into nanodroplets. And again, we can separate them and go for freeze drying them or storing them until the age. So though there are other techniques, in all these core techniques, the only aspect that we look upon is the basic emulsification is not going to change. But the only change is what kind of an organic solvent that we choose will decide whether we are going to form a nanocapsule or a nanoparticle, or the efficiency of the method. Everything will be depending upon the type of organic solvent that we choose, solvent evaporation or sorting out, whatever it is. So these are some of the techniques that we use for polymeric nanoparticles. So now coming to another important class is the lipid nanoparticles. We all know that lipid nanoparticles has been here for many decades, and liposome is the first generation lipid nanoparticles. And why we use lipid nanoparticles, or why they are much more important, is these lipid nanoparticles are capable of loading the drugs which falls under the class 2 and class 4, which are having very poor solubility. So these lipid nanoparticles are capable of increasing the solubility of these drugs, and thereby they will be able to increase the bioavailability of the drug. And also these, since they are lipids in nature, they are easily biodegradable, and they have low immunogenic properties, and that's the reason lipid nanoparticles have been given more due importance in the recent times or since a long time. So these lipids also have got the capability to increase the absorption of many poorly soluble drugs from the gastrointestinal tract by the same means of how our food is getting digested. Since they are lipids in nature, easily digested through the gastrointestinal tract. By the same mechanism, many drugs, poorly soluble drugs, can be loaded into them, so that they will be absorbed from the oral tract itself, GI tract itself. So now coming to liposomes. So we know that liposomes have been here since many decades, since the advent of approval of the first liposomal product by FDA in 1991. They are vesicles. We all know that they are vesicles, and they are composed of amphiphilic phospholipids. So what significance it gives is they can present both hydrophilic drugs as well as hydrophobic drugs into their structure, and they can be produced in different structures like unilamellar, multilamellar, or large sized liposomes. Everything is possible with liposomes. It's one of the most extensively studied nanoparticles as such, and moreover, based upon the phospholipids which we are using, they will acquire different charges, maybe neutral or cationic or anionic, according to the charge that is carried by these liposomes. They will have a different type of a fate in the biological system. And also liposomal drug delivery has found a profound, the first marketed nanoparticle drug delivery system, as I already told you. They doxorubicin is included. Similarly, daunorubicin or amphotericin, all these are very successful products that are approved by FDA, and they are in the market. And these liposomes, once they are pegylated, which we are going to talk very detailed in the forthcoming sessions. So once these liposomes are pegylated or surface coated with PEG, polyethylene glycol, their half-life increases tremendously to 45 hours. Thereby, they will be in circulation for a longer duration, and they will be able to, release the drug, in the intended area for a longer duration. That's why liposomes has got such a great importance. But of course, liposomes are not devoid of limitations. Liposomes, such, they have some complex production techniques. We have to involve a number of organic solvents. People who have, prepared their liposomes in the laboratories know most of the methods involve organic solvents. So they have some complex production methods. So, yeah. Any problem? Oh, background noise ఎక్కువ ఉందా? I'll just check out. Okay. Not a problem. Can you just give me a moment? I'll just check out. Just give me a couple of minutes. I'll just change the place or something. Okay. Okay. Hello, dear participants. Since I'm not sure, why there is a background noise here, I'll just check out what it is and just give me a couple of minutes so that I'll rectify the problem from my side.
Okay, sir.
Hello. Hello. Could you hear me?
Yes, sir.
How is it
Yes,
now?
sir. Now
There
it
is
is
no
okay, sir.
disturbance. Okay. Am I going a little fast? If you tell me, I'll slow
No, sir.
down.
No, sir.
Because
It's going
okay.
well, sir.
Because I just wanted to cover larger prospects. So that's why I'm going a little fast on the areas where I just don't want to. So shall I proceed now?
Yes, sir. Yes, sir.
Okay. Sorry for the inconvenience because probably the classes were soft skills classes were going on beside me. There were mono actings going on, so that's a problem. So I just shifted to my lab now. So hopefully there are no problems after this. If there are any problems, please stop me. I'll just rectify any problems on my side. Okay, thank you very much. So now, sorry for the interruption. Now let me get back to the presentation once again. Is it shared one? Hello.
Yes, sir.
Okay, it's in the full screen mode, right? So shall I proceed?
Yes,
now?
sir.
Okay.
Yes, sir.
So though liposomes as such, they are much celebrated dosage forms. They are very successful, despite they are not free from disadvantages. As I was saying, most of the methods that we use for preparation of liposomes, be it the handshaking method or lipid hydration technique or solvent injection techniques or sonication techniques, all these techniques which most of us are much aware of, all these techniques generally involve organic solvents. And many a times the liposomes, because of their architecture, they will not be able to entrap a large payload. Payload is the term that we use for the amount of drug that is put in. So the payload is generally much less. And moreover, we will not be, these nanoparticles, liposomes couldn't be prepared in a very large scale, which the industry actually requires. So as a result, scientists were in search of alternative lipid nanoparticles. And Mueller, he's one of the most cited author with regard to the lipid nanoparticles. And Mueller, he developed a delivery system, a nanoparticulate drug delivery system based upon lipid called as the SLN, or the solid lipid nanoparticles. And later on, in the recent times, before a decade ago, we also developed one more delivery system called as the nanostructured lipid composites or complexes. So these NLCs. So SLN and NLC, these two are the second generation type of lipid nanoparticles. And these two delivery systems, SLN and NLC, they both are much capable of overcoming the problems that are usually encountered with the liposomes as such. See, for example, these two delivery systems, SLN and NLC, they have enhanced physical stability. They are more stable than the liposomes, which are generally leaky in nature. And they have higher loading capacities than the liposomes. The bioavailability of their cargoes and their ability to sterilize, all these are better properties of these solid lipid nanoparticles and nanostructured lipid complexes. See, for example, very importantly, these SLN and NLC can be prepared in a very large scale. And that's the greatest advantage. By using homogenization technique, we will be able to develop them into a very large scale at an industrial level. So that's the reason SLN and NLC are much more preferred than the liposomes. Nevertheless, liposomes will also be a classic, but SLN and NLC has got advantages over the liposomes. So now, when we're talking about SLN and NLC, again, SLN has got a problem. The problem is that these, we know that structurally, solid lipid nanoparticle comprises of a large amount of solid lipids, whereas the NLC generally comprises of solid lipids along with liquid lipids. So now what happens is SLN, as such, they will be able to take up more amount of drug initially, but later as we, store them, what happens is these lipids, solid lipids that are used, tend to crystallize. Once they are very organized, since the structure is very organized, these solid lipids tends to crystallize. As they crystallize, they occupy the portions much and expel the drug that were interspaced between them. For example, see, if this is the solid lipids that we are talking about, initially the drugs would be at the center. So it would be interspersed in the entire solid lipids also. But as these lipids crystallize, they take up the lattice and they push the drug out of their area. So what happens is the amount of drug that are actually loaded will expel out of the SLN. So this is the biggest problem that is generally encountered with SLN. So NLC came into existence because of this important problem. NLC were introduced. In NLC, the structure is like that, where we don't have only solid lipids, we have some liquid lipids also, kept along with them. So now what happens is these NLC do not crystallize in the way SLN crystallizes. So since there are liquid lipids present in between, they don't crystallize, they have space in between, and as a result, the drug whichever is loaded inside will remain there without expelling out. And as a result, NLC has got better loading capacity than SLN. That's where NLC is scoring slightly higher than the SLN. SLN is again one highly researched nanoparticulate drug delivery system, but it had got its limitations. I'm hearing some odd sounds out. Hello.
Yes, sir.
I'm hearing some odd sounds out. Is there any problem?
No, sir. Nothing, sir.
No. Okay. So I could hear some sounds, odd sounds. That's why. Okay.
Oh, sorry, sir.
No, that's okay. But is it still? The slides are visible. The slides are still visible, ma'am?
No, sir. No, sir.
No, I'll share it once again. That's why, since I came out, it would have. I'll share it once again. I thought it is getting disconnected, so I had to stop. Sorry. Now it's clear, right? Okay.
Yes, sir. Yes, sir.
So I would like to give a small introduction regarding the magnetic nanoparticles also, because they are one another class which are very, very important. See, these magnetic nanoparticles, again, they have the size of 1 to 100 nanometers, but they have super paramagnetic properties, which means these particles are capable of getting magnetized once they are present in an external magnetic field. Suppose we create an external magnetic field like in an MRI. So, and at that once this magnetic field is created, around them, they will behave like a magnetized material. But once this external magnetic field is removed, immediately they lose their magnetization, which means they do not retain the magnetization capability. And that's the reason why these magnetic particles are much efficient in diagnosis as well as treatments. So they are very important nanoparticles which are coming under a class called as theranostics, where the same material can be used for both delivering the drug as well as for diagnostic purposes. So I'm not going to the details of all this, but among all the magnetic nanoparticles, these iron oxide nanoparticles are the most commonly used because they are much biocompatible and they are very stable. Whereas cobalt nanoparticles, they are less stable, but they are more toxic. And nickel nanoparticles also, they have high toxicity concerns. That's why we generally don't use them for diagnosis purpose or for treatment purpose. But iron oxide nanoparticles and the magnetic alloys, they can very well be used alloys of iron oxide along with platinum, they can make out very good magnetic nanoparticles, because they have very good anisotropy as well as the stability. So among all these magnetic nanoparticles, iron oxide is the most preferred. So because of their super paramagnetism, as I already told you, they get magnetized in presence of external magnetic field. Once it is removed, they lose their magnetization, and therefore they don't agglomerate. So suppose if they retain their magnetic capability even after removal of the external magnetic field, they will agglomerate, but that doesn't happen because of their super paramagnetic properties. And again, one more important, wherever we talk about nanoparticles, the size comes to play. So here, if the size of the particles is very, smaller the particle size, the greater will be the magnetic behavior. It's because, as I already told you, once the size is reduced to below 100 nanometers, they have quantum effects. So because of the quantum effects, they will have better magnetic behavior. But again, we cannot go down too much. So once you go very smaller size, 10 nanometers range, then again they lose their magnetic abilities. To super paramagnetism is lost. And these magnetic nanoparticles can again be coated with polymers to increase their bioavailability. Therefore, we can use them for various biomedical applications. So another important class is the metal nanoparticles, which everybody is aware of. Very importantly, the gold nanoparticles and the silver nanoparticles. Why we use these gold and silver nanoparticles is because they have some unique properties which are optical. We can tune the optical properties of these these nanoparticles. That's an important reason why we are using them. See, many nanoparticles are there, can use platinum, copper. Many different nanoparticles are used, but their properties are much applicable to chemical reactions, or for engineering purposes we can use them because of the electrical conductivity property, because of the catalytic property. But when it comes to biomedical application, gold nanoparticles and silver nanoparticles are much commonly used because they exhibit, all these nanoparticles, of course, they exhibit the surface plasmon resonance. Whenever we make gold nanoparticles, we look into the UV range, whether this surface plasmon resonance is available in the range of 400 nanometers. So once a peak is shown there, we generally feel very good, because it means that the particles are exhibiting the surface plasmon resonance, and this property is responsible for their optic properties, which can be used for hyperthermia treatments or for diagnostic purposes. So probably the same points are covered here also. So let me move further. So this is my second part of the presentation, where I would like to talk about the cellular interaction of nanoparticles. As an academic researcher, whenever I was doing nanoparticles, most times academic researchers, we worry about how the nanoparticles are formed, the synthetic methods. Then we go for the evaluation, we do the characterization, we look into the size, the zeta potential, we look into the morphology using SEM, TEM, or AFM. We do all this process, but what we should look upon is how these nanoparticles are going to behave in the biological system. Because we can make a very successful nanoparticle in an external environment, but the same nanoparticle which has got very good properties, very good characteristics in your evaluations, may fail very abruptly once they enter a systemic circulation. Because the systemic circulation, or the biological system as such, is very complex, and there the behavior or what happens to the nanoparticle is a very big question. So it is very important that we understand these biological processes that act upon the nanoparticles in order to design the nanoparticles still better. So we need to see the area of application is our systemic circulation or into a localized area. So it is our body as such. So into the biological environment, what would happen to the nanoparticles? Maybe in the laboratory, in a test tube, these nanoparticles are very efficient. They release for more than 24 hours, even few days, few months also. We can manufacture. We can prepare them. But once they are injected into the systemic circulation, or once they are administered by any other routes, do they remain stable? So that we should, or what are the factors that's going to affect their stability and their efficiency? We have to understand. So once you understand these phenomena, we will be able to tune the nanoparticles or surface engineer the nanoparticles in a way. So that is what I am looking, to explain in the, forthcoming slides. So in many of the literatures, it is very clearly mentioned. Once a nanoparticle is injected, you call it any lipid nanoparticles, whatever be the nanoparticles it is, once you inject into the systemic circulation, into the blood, it is generally documented that these nanoparticles are cleared or completely removed bloodstream within few minutes. So even if they are very effective for 24 days in an external environment, in the biological system, they don't stay because our cells remove them very fast. So if they remain there only for 3 minutes, how would they circulate? How would they reach the point where they want to elicit the therapeutic? Be a big failure. So that's why we need to understand what kind of an fate the nanoparticles are going to have within the biological system. So first, I would like to put in a very simple terms as what happens. Once the nanoparticle enters. Let us imagine that the nanoparticle is injected into the bloodstream. So now what happens is, supposing if the nanoparticle comes to an environment where there are no materials around, then there is no problem at all. The nanoparticle will have a very safe travel. But unfortunately, we are injecting into the blood, which has got numerous biological substances. So the nanoparticles don't have any other choice. They have to interact with these biological components. So the first and the foremost component that comes into contact with the nanoparticles is the proteins that are present in the bloodstream. So what happens is, once the nanoparticles comes into contact with these proteins, the proteins just form a coating over your nanoparticles, and this coating of proteins around the nanoparticles is called as protein corona. So what happens is, you might have prepared a nanoparticle of a size, and you might have prepared it of a particular charge, but once these proteins cover them up, the complete properties of the nanoparticles is altered. Their size is altered, their charge is altered, and their biological fate as such is completely altered. So this process of coating, or this process of interaction of the proteins with the nanoparticles is called as opsonization. So this process of interaction or forming a complex around the nanoparticles by the biological proteins is called as opsonization process. This opsonization process is going to decide the biofate of our nanoparticles. That's the most important aspect we have to look upon. So once this opsonization is done, I will talk about what happens once these proteins are covered. Once this proteins covers them, our nanoparticle becomes visible to the eyes of phagocytes, and the phagocytes engulf them. They will throw them out of our system within a few minutes. This is what happens. So opsonization, or this protein corona, has got a profound effect upon the stability or the off-life of our nanoparticles. Suppose we want longer off-life of our nanoparticles, then we have to escape the opsonization process. We have to protect our nanoparticles from the deposition of protein corona. But that's not a very easy job. We have to engineer them in such a way that they escape from this protein. So proteins are ever in the bloodstream. So wherever the nanoparticles travel, they will be forming a protein corona. Let us discuss more about what is the opsonization process. As I already told you, so this protein corona is not, the complexity is that this protein corona is not static. One protein comes and binds, and a few more proteins comes and binds, and it forms a layer. It's not like that. It is highly dynamic in nature. Means the proteins that is covering these nanoparticles are continuously going to be in motion. So we cannot decide that only this protein comes and binds. The proteins continuously change. Absorption and desorption of proteins is actually going to take place. So let me put it in the first way to inform you that there are two different types of protein corona upon a nanoparticle. One, it could be a hard protein corona. We call it as hard PC or soft PC. Hard PC is nothing but those proteins, which are having high affinity to the nanoparticles. So they will, form a hard corona. Any protein that has got very high affinity, they will form a high, soft corona are those proteins, okay, which will bind to another protein. Say, for example, we have a nanoparticle. Upon the nanoparticle, there is hard corona, and to the hard corona, the other proteins will come and absorb, and this is called a soft corona. So hard corona and soft corona both will be there during the opsonization process. Let us discuss in a little more detail. As I already told you, adsorption and desorption takes place. This protein, opsonization process as such is a very dynamic process. It's completely going to be, completely going to change. Continuously, there is going to be some changes happening on the surface of this corona. So this could be explained by two different processes. One is called the Romans effect. The other one is cooperative adsorption. According to the Romans effect, what happens is competitive adsorption and desorption takes place on the nanoparticle surface. What is this competitive adsorption and desorption? Simply, once the nanoparticle comes into the bloodstream, first, some proteins are present in larger quantity. They come and absorb. They may not have greater affinity. They may have low affinity also. But since they are present in larger quantity, they will come and absorb with the nanoparticle. So this, these proteins, since they don't have much affinity, later on, after some time, proteins which are present in lower concentration but has got greater affinity, they will go and replace them, or they will competitively absorb them. So that's what happens. So initially it is the abundant proteins that will first absorb the nanoparticles, and later on they will be replaced by the higher affinity, low concentration proteins. Okay, this is called as Romans effect. According to Romans effect, initially it is the low affinity, highly abundant proteins that will form the corona. Later on, they will be replaced by the high affinity, low concentration proteins. So this is how the Romans effect explains the adsorption and desorption. Cooperative adsorption is another, as I already told you. There is one layer of proteins, and this layer of proteins they form a scaffold. Upon this scaffold, another proteins come and absorb. So as I already told you, they are the soft coronas. Some proteins don't directly go and bind with the nanoparticle. They will bind with another protein only. So they will, some proteins will go and absorb to the hard corona. So since the hard corona is supporting the soft corona, this process is called as cooperative adsorption. So I have explained this process in this image, if you can look at. So you can see that initially, the dark spotted, proteins are staying away because they are present in very low concentration. But you can see a number of, this blue colored, purple colored, balls that you can see, they are present in higher concentration, but they have low affinity. As the time progresses, you can see these dark colored ones have replaced the low affinity proteins. This is what happens. And you can also see, the cooperative adsorption, where these proteins do not directly absorb to the nanoparticle, but they absorb to the already existing proteins. So this is called as cooperative adsorption. So what you have to understand as such is this protein adsorption itself is a very complex phenomenon. So and this corona is highly dynamic in nature, so it is very difficult in a way that we could avoid it. But until and unless you don't avoid the opsonization process, your nanoparticle are sure of getting engulfed and removed by the macrophages. So we are going to talk about that later. But opsonization is the first step that you need to avoid. We need to shield our nanoparticles against the opsonization process. So there are three main factors that will affect the opsonization process. The first one is the nature of the nanoparticles itself. What is the size of the nanoparticle? What is the size distribution as such? What is the charge? What is the surface? Surface chemistry, maybe what is the hydrophobic nature or hydrophilic nature. Generally, any nanoparticle which has got a hydrophobic surface, maybe water insoluble surface, they will be immediately absorbed by the proteins and they will be immediately removed from the bloodstream. The second important factor is the biological factor, which is going to depend upon the proteins. So what kind of a protein it is, whether it is highly affinity protein or low affinity protein, whether it is present in high abundance or low abundance. All these are biological factors which totally depends upon our system. The third one is the conditions in which this absorption takes place. What is the temperature? What is the ionic strength and the osmolality in that region? So experimental factors we say, or what conditions prevail at that juncture where the opsonization takes place. So three factors. One is related to the nanoparticle, the other one is related to the protein as such. Okay, so the fact is very simple. Supposing if you want to avoid opsonization, you have to engineer the size, you have to engineer the charge, and you have to engineer the surface. So that is what is in our hands. We certainly don't have the abundance or the high affinity proteins and low affinity proteins, which we cannot design, which is a biological factor. But what we can engineer or we can design is the size, the charge, and the surface of the nanoparticle. So that is what I want to emphasize. Suppose if you want to avoid the opsonization process, because if you don't avoid the opsonization process, your nanoparticles are not going to stay in the blood for longer. If they are not going to stay longer in the bloodstream, they won't reach the place where they want to go. Suppose if you are targeting it to a tumor, it will not reach the tumor area, and then there is no talk about endocytosis or entering the cell as such. So the next one, or the important biological encounter that we need to do is endocytosis. See, now a nanoparticle has come to the extracellular region. Now the cells have to take them inside. We have to understand how this endocytosis process takes place, because all the endocytosis process don't take place by the same manner. So we have to understand how this endocytosis takes place in order to design the nanoparticle in a better manner. So we can majorly divide this endocytosis process into two. One is phagocytosis, the other one is spinocytosis. We all know about what is phagocytosis and spinocytosis, but phagocytosis has got other mechanisms also. So phagocytosis, clathrin mediated endocytosis, caveolin mediated endocytosis, clathrin, caveolin, independent endocytosis, and finally macropinocytosis. So the first four techniques, these four are generally called as phagocytosis process only. Okay, they are different methods of phagocytosis. They are going to engulf a solid particle, whereas the final one is called as macropinocytosis, which is more of a liquid engulfing type. So let us discuss about all this 5 mechanisms to understand about how this actually takes place, and we will also talk about some research outputs, how they have designed these nanoparticles as such. Okay, so first to talk about phagocytosis. See, what are these phagocytes? First of all, phagocytosis is the process of engulfing of any material that comes into our body by the phagocytes. So any xenobiotic that enters into our body will be removed by the phagocytes. I don't know if I'm exceeding my time. Amulya madam, can I go ahead?
Yes, sir, you can, sir.
Even
the topic is interesting, sir. You can go, sir.
So because I think I may go up to 4:15 also. So because there is more to discuss in order to complete it. So let us now talk about this phagocytosis process. See, phagocytes as such are professionals. See, our body will get many type of foreign organism entry. All these foreign organisms are removed by our macrophages or phagocytes. So we have to understand one thing, all this phagocytosis process, what are mechanisms that I have told you in the previous slide, they are developed by our biological system for their own purpose. They are not developed for the drug or nanoparticles. They are specifically developed by our body for some transport for the convenience of the body. We are exploiting those mechanisms for taking our drug load into the cells. That is the actual, way it is happening. So this phagocytosis is a natural process. For example, a microorganism enters into our body. The phagocytes are those cells which are going to remove them. How they are going to remove them is what we are going to see. The same fate is going to happen for nanoparticle also, because our body considers both a virus or a bacteria as well as nanoparticle in same terms only. They don't say them different. They are all xenobiotics to our body. So these phagocytes are nothing but professional cells. Okay, and these professional cells are present in different parts of the body. Maybe we call it as Kupffer cells. We call them as macrophages. We call it as monocytes. All these are different types of phagocytes. And these cells engulf these particles by a process called as phagosome. Okay, so not only these specialized professional cells, there are even endothelial cells and non-endothelial cells also do this phagocytosis process, but they are called as paraphagocytes because they are not professionals. Cells like macrophages, which are part of the mononuclear phagocytic system, or these are present in the reticuloendothelial cells. So these macrophages, monocytes, neutrophils, and dendritic cells, these are specialized cells in the body, present in different organs, and monocytes are present in the blood itself. So these are professional phagocytes, and these are responsible for the host defense mechanism. And what they are going to do is not only, defense mechanism, we have our own dead cells, we have cell debris. All these will be engulfed by these phagocytes only. But we have to understand one more thing. These phagocytes are blind. Let me put it in a very simple term. They are blind, which means they will not be able to recognize our nanoparticles as such. They generally don't see our nanoparticles. So how do they identify our nanoparticle and engulf them is the biggest question. There comes our opsonization process. Let us consider this area. So we have the nanoparticles. Once the nanoparticle comes, because based upon their physicochemical properties, the blood components or the plasma proteins comes and adheres to them. So now, once this protein corona is formed, our phagocyte is capable of, recognizing only these proteins, not our nanoparticles. So once this opsonization process takes place, our phagocytes, in simple terms, will be able to see our nanoparticles. So that's why I say, opsonization process has to be avoided, or we have to shield our nanoparticles against opsonization. Once opsonization is done, our nanoparticle becomes visible. So once it is visible, how it is visible is because these proteins are, complements to the receptors that are present on the phagocytes. The receptors, are of different types. It can be complementary receptors, or it could be FC receptors. So it can be any different type of receptors which are complement to these proteins. So now what happens? Once these proteins are available, the receptors that are present on the phagocytes identify these proteins and they go and form a bond. So once this bond is created, a number of cascading events, like our blood clotting process, a number of cascading events takes place, and an actin, formation is done. An actin assembly is formed. So as a result of it, you can see these two arms, right? So a phagosome is formed, means two arms are created, just like our amoeboid, pseudopods. These two extend their, cytoplasm and cover them, engulf the, nanoparticle as such. So a lysosome is formed inside. So where the lysosomal secretions, break the nanoparticles, allow them to release, and all this happens. Supposing this is where it is very important. So now, hopefully you understood the process of phagocytes. So now what very importantly we have to look at is these phagocytosis process. Is sometimes good, sometimes not good. Say for example, let us have two conditions. I have, say a person is having a tumor, in a region beyond the mononuclear phagocytic system or reticuloendothelial cells. See, the reticuloendothelial system will have your spleen, liver, kidney, all these organs are part of the RES system. But there are organs other than these systems also. Now, if the phagocytosis process takes place, let us consider that the liver has got a tumor. Okay, we got this liver carcinoma, and you want to give the drug to the liver itself. Now, I will not engineer my nanoparticle. I will develop a nanoparticle, put in my drugs, and I will inject it into the blood. No, what happens is these nanoparticles will travel, and once it reaches the liver macrophages will immediately engulf them, which will take it into the liver cells, hepatocytes. So now there the drug will be released, and what happens immediately? The liver carcinoma can be treated. Okay, or the liver carcinoma cells will be destroyed. So you can utilize this process of phagocytosis very effectively if you are targeting the cells of, organs of the RES system, maybe liver. I'll give you another classical example. Sometimes in the macrophages of the liver itself, which is our phagocytes, so there itself fungal infection might come. Okay, there are fungal infections that are possible within the macrophages of the liver. Now, our target itself is macrophages. Now, we can very well give a nanoparticle, and we can allow the opsonization process to take place, and the phagocytes will engulf. The drug is released into the phagocytes, and they are treated. So, when you are targeting the liver or targeting, spleen, targeting the RAS organs, phagocytosis is good. But if you are targeting a drug to a tumor, maybe in a muscular region, maybe in any other organ, then we don't have the nanoparticle. Phagocytosis is not helpful. We have to avoid the phagocytosis. At that time, we have to avoid opsonization as well as phagocytosis. And that's why we do the pegylation process. See, very importantly, as I already told you, the size will have a bigger impact. The charge will have an impact. But the most important factor that will have an effect upon the opsonization process and phagocytosis is the surface characteristic. If a nanoparticle has got a hydrophobic surface, then certainly opsonization is invited. You can see here. So here we have a naked nanoparticle, and we can see opsonization immediately takes place around this nanoparticle, and it is engulfed. Whereas instead of a naked nanoparticle, if I coat it with hydrophilic polymers like polyethylene or polaxamer, now this PEG will have a repulsive force, and this repulsive force will counteract the attractive force between the protein and the nanoparticle. Protein tries to attract the nanoparticle, whereas the PEG coating will repel the protein absorption. So as a result, the opsonization process will not take place. And once opsonization process does not take place, the phagocytes will not be able to identify the nanoparticle. And what happens is they will not be able to engulf it. And as a result, that is why the liposomes which are coated with PEG, we call it as stealth liposomes, and they will stay in the blood for nearly 45 hours. And during these 45 hours, they will be able to circulate in the blood for a longer time. They will be able to identify the region where they have to go, and they will reach the site, and they will be able to produce their therapeutic effect. And that's why phagocytosis is so important. And that's why this PEG coating or pegylation is very, very important in designing a nanoparticle. So the other mechanism is the clathrin-mediated endocytosis. This is again very important mechanism by which these nanoparticles are taken inside our cells. And before I explain this process, let me tell you our very famous PLGA nanoparticles, or polycaprolactam nanoparticles, or PEG co-PLA nanoparticles. All these are engulfed or endocytosized by both clathrin-mediated and caveolin-mediated endocytosis. The mechanism of endocytosis, because we want them to go into the cells. So the mechanism is this. Phagocytosis is different, where they clear them. But clathrin-mediated endocytosis is the process by which the cells actually take them up. We actually, have to target, design them in such a way that we have to, identify a mechanism by which they are taken up inside. So endocytosis is the process by which the cells are actually taken inside. Clathrin-mediated endocytosis and caveolin-dependent endocytosis, both these are very much helpful for taking the nanoparticles inside the cells. Let it be a cancer cell, or it can be any other inflammatory cell which you want to treat. But these are the mechanisms by which the nanoparticles are taken inside and their components are released. So what about this clathrin-mediated endocytosis? This is a very specific mechanism. This mechanism, it is actually operated by our cells for the purpose of obtaining the nutrients and obtaining the plasma membrane components by using some low density lipoproteins. So this is a normal mechanism that is operating in our body. So this clathrin-mediated endocytosis actually occurs by a receptor specific way, or it can even happen without receptor specific. We call it as receptor dependent CME, receptor independent CME. Both the ways it can take place. When it is independent CME, then we have some interactions like hydrophobic and electrostatic interaction. But most of the times it is receptor mediated CME. CME is the short term that I use for clathrin mediated endocytosis. So CME is actually present in our body. In the plasma membrane, it is actually occupying a region of about 0.5 to 2% in the entire cell membrane. If you look at, they actually occupy a 0.5 to 2%. So only in the regions where clathrin is highly available, this process can take place. And this clathrin assembly unit is called as triskleon. So this triskelion is a protein, and it has got three-legged structure. It has got three heavy legs, sorry, three heavy chains and three light chains. And this protein, and there are other proteins also. So these are responsible for forming this invaginations. We actually call this cavity formation as the invaginations. So this clathrin is responsible for construction of these invaginations, but initiation, I mean, where it has to happen and how it has to happen, all these are decided by other proteins called as adapter proteins. They will decide where this budding has to happen. So we have an adapter protein which will decide where the budding should start. So we call this process as called as nucleation. This nucleation of clathrin actually is helped by an accessory protein. So this accessory protein will actually initiate the nucleation. Once this nucleation takes place, this clathrin will form a complex. This complex actually forms pentagons and hexagons. You can see, a three-dimensional structure is formed. So once this three-dimensional structure is formed, it forms a cavity, and this cavity is stabilized by accessory proteins again. These are called as amphiphycins. So this cavity is formed, and what happens once the nanoparticle is here, the cavity is formed and they actually engulf them completely. Now we can see there is a connection between the surface of the plasma membrane and this cavity. So we have to cut them off. For that, we have a specific protein called as dynamin. This dynamin cuts off this clathrin cavity from the cell membrane, and it is free to move within the cytoplasm now. Now within this, decoding, again the clathrin decodes, goes to the surface, and it is ready for engulfing again. So inside this, lysosomes will release their components, and all the drug and the payload that is present in the nanoparticle will be released. Supposing if this is your cancer cell, and this is how the endocytosis process takes place. As I already told you, PLA, polyethylene glycol colactide, PEG, co-PLA, many of the nanoparticles that are produced, that we manufacture and design, they are engulfed by this clathrin-mediated endocytosis. The other one is the caveolate-mediated endocytosis. Again, this caveolate-dependent endocytosis is a normal biological process. This is generally used for maintaining the tension of the membrane. We have two specific proteins called as caveolate and caveolate-2. The caveolate is responsible for the production of a flask-like structure, whereas the caveolate-2 is responsible for the stabilization of this membrane. So both these proteins are involved. Both are dimeric proteins, and these dimeric proteins are involved in the formation of this invagination and engulfing of the nanoparticles. And you can see similarly, like our CME, here also dynamin will help. This is a scission protein where it will scissor the flask-like structure and it releases into the cytoplasm. And here we have to understand one thing. For caveolate-mediated endocytosis, lysosomes are not involved. So since lysosomes are not involved, we cannot make a nanoparticle which has to be digested by lysosomes. So since lysosomes are not involved, many of the viruses use the same mechanism for entry into the cells. Okay, and one of the best-selling nanoparticle, or let me say blockbuster product in nanoparticle, is Abraxane. Abraxane is nothing but an albumin which is adhered with a number of trillions of paclitaxel molecules. And Abraxane generally enters into the cell by this caveolate-mediated endocytosis. So since they understood the caveolate-mediated endocytosis, they were able to design a nanoparticle, okay, called Abraxane. Paclitaxel as such has some problems. Though it is a blockbuster molecule, it had problems of neurotoxicity and nephrotoxicity because of the solvent issues. But once Abraxane was produced, which is here albumin adsorbed, paclitaxel adsorbed on albumin molecules. So once this Abraxane was approved by FDA in 2012, it increased the therapeutic efficacy of paclitaxel. So which is the first line of treatment for cervical as well as, breast cancer treatment. So understanding of this caveolate-mediated endocytosis is the prime. Okay, there are cases where these might not help out. There are some cases where without clathrin, without caveolate, we have some formation of pits. We can see here in the diagram sometimes the cells form raffles like these. Arms are produced and they engulf a large amount of endoplasm. The extracellular fluid. actually has got a size of about 0.2 to 5 microns, which is a very large size. So it engulfs a lot of liquid, along with the nanoparticles will also come inside. When you are talking about CME or caveolus-mediated endocytosis, the cavities that are formed are very, very small. Whereas if you want to endocytose a large nanoparticle, then macropinocytosis is the only way the cells actually do it. Okay, so these are the various mechanisms by which endocytosis takes place. Now, excuse me. So now we are. I don't know if I'm going beyond time, but I would like to have some emphasis on the targeting, where I would like to talk about the passive targeting as well as the active targeting. I don't know if I'll have enough time for active targeting, but I will at least touch the important aspects of it. But this is another important area that we have to understand. Matsumura and Maeda, these are two researchers who are working with nanoparticles which are made up of polystyrene co-malic acid. So they were making a 16 kilodalton polymer conjugate. So the total size is 16,000. So what happened is they injected it into the body, and they found that they were able to bind with the albumin. So what happens, 16 kilodaltons, and albumin has got a size of about 60,000 daltons. So put together, they actually make a 80 kilodalton molecule. And this 80 kilodalton molecule was very well, able to retain within the cancer cell. They were not pushed out. So they were, doing a number of research after that. They were making different sized, nanoparticles, and they finally came to a conclusion. How the cells are, how the nanoparticles are retained within the cancer cells, and they devised the, important phenomena called as the enhanced permeation and retention effect. Probably everybody might have heard about the EPR effect, but we have to understand that this EPR effect is the golden standard for passive targeting. Suppose if we are trying to make a nanoparticle which would circulate for a longer duration in the blood, then we have to worry about this enhanced permeation and retention effect. So fortunately or unfortunately, the cancer cells are a part of our body, but they have different demands. So the normal oxygen supply and the normal nutrient supply might not be sufficient enough for these solid tumors that are developing in our body. They have a very high rate of metabolism. So as a result of them, the blood vessels that are actually normally, giving the ration to them, the nutrients and the supplements, they were not sufficient for them. They have a high demand. So they make their own blood vessels. And this process of formation of new blood vessels by the tumor cells is called as angiogenesis. Angiogenesis is a common word for formation of blood cells, but angiogenesis is being carried out by the cancer cells. And when they are making them, since they are rapidly formed, normal blood capillaries are formed very slowly. But since the cancer cells are actually making these blood vessels at a very faster rate, they make it improper. So as a result, the normal architecture of the blood vessel is different from the tumor blood vessels. So there are, between the endothelial cells and normal blood vessels, there is a small gap. Everybody knows that, there will be a very small gap between the endothelial cells. But in cancer, blood vessels or the angiogenetic blood vessels, they have a very huge fenestrations. The fenestration in some animals, animal models, it has found that it is between 200 nanometers to 1800, which I have read. In some other terms, it's even 2000, but it is not exactly proved in human beings. But many of the animal studies, it is proved between up to 2000 nanometers. So we can develop. So if you have a nanoparticle which is about 1500, which means almost 1.5 microns, will also be able to cross it. So what happens? Any nanoparticle or any particle which has got this size, okay, which can up to 2000, they will not all fenestrations are 2000 size. We are talking hypothetically, but if they are even larger, they will be able to move into the cancer blood vessels, which angiogenetic blood vessels. So they will be able to reach inside the cancer cells. This is called the enhanced permeation. They are able to move inside the cancer cells. Okay, any cell has got input as well as output. So something comes inside, and there is a mechanism for taking the excretes out of the cell also. Exocytosis, we generally say. This generally is present in any cell. So even in cancer cells, if something comes in, they should go out. But this going out in a normal cell, this going out is generally taken care by the lymphatic vessels. the lymphatic drainage is present in the normal cells, and this flow velocity is usually about 0.1 to 2 micrometer per second. This is common in normal cells, but what happens with cancer cells is that they don't have this lymphatic vessel recycling. Means there are no lymphatic drainage. They are defective if they are blocked. So as a result, anything that comes inside will stay within the cells and will not be able to go out. So now what happens when we have an advantage here? Suppose if we can make a nanoparticle that can go through this, small fenestrations of the blood vessels, and if they can go into the tumor cells, they will stay there within the tumor cells because there is no lymphatic drainage. This is called as enhanced retention. So we have enhanced permeation as well as enhanced retention. Because of this enhanced permeation and retention, if you can design a nanoparticle, properly, they will, and if they can circulate in the blood for a longer duration, because that's very important. Only if they circulate in a longer duration, they will be able to, go to the region of the tumor. They will be able to enter this, broken architecture of blood vessels. They can enter the tumor cells and they can be retained there. So longer circulation is mandatory. Since it happens by their own natural movement in the blood, we call it as passive targeting. Okay, from a region of higher concentration to region of lower concentration, they move. So this is the way of passive targeting. So for better passive targeting, we have to come to the same point. So the size, the charge, the shape, as well as the surface is very important. But as I already told you, if you are okay, we have a fenestration up to 2000 nanometer. It doesn't mean that we can make 1.5 microns. Why? Because if you are making, a very large nanoparticle, then they will be engulfed even before they come to the tumor site. They will be engulfed by the reticuloendothelial system, because for larger nanoparticles, opsonization is also not needed. The phagocytes will easily recognize them and they will engulf them. Okay, because larger nanoparticle will immediately recognize more proteins. Opsonization takes place instantaneously and removal also takes place instantaneously. So you cannot design a nanoparticle larger. If you make it very smaller, then they will be filtered by our kidneys itself. So the problem is, so we need to make a nanoparticle of a size which can escape, which should be larger than our globular filtration, and it should be smaller than those which are identified by the RES system. So anything between 200 to 300 is a optimal size. I'm just suggesting it. The lower it is, 100 to 200 is very good. Even up to 300 for passive targeting, they are okay. So that's how we actually design a nanoparticle for passive targeting. In this particular image I have shown, excuse me, on the left hand side you can see a normal architecture of blood vessels, a normal blood vessel. You can see the endothelial cells are intact and there is no room for these nanoparticles to come through this. And also you can see there is a lymphatic drainage here. Even if they enter through this, they will be immediately, any nutrients that are present here, they will be immediately removed through this lymphatic drainage. Coming to the tumor blood vessels, angiogenic endothelial cells, you can see that the architecture is not proper. There is a lot of gaps here. This is what we call it as fenestrations, and this size is what we are talking about, 200 to 2000. So any nanoparticle will be able to easily pass through this and they will stay with the. But the very important thing is that they will not be able to move through the lymphatic drainage, as the lymphatic drainage is blocked here. Okay, so that's how we actually passively target by using the EPR effect. So since I'm running out of time, I will basically touch the active targeting. So with regard to the active targeting, I'm not going to talk in details because of the time limit. So instead, let is there somebody else talking? So here we have this active targeting. Everybody knows, but I would like to give a small glimpse about it. See, this active targeting as such is a simple can I please request the participants to mute yourself so that other participants will be able to hear me out, and I will not take much time. I'll just try to wind up as early as possible. Okay. With regard to the active targeting, so we need to identify some.
I request all the participants to please mute your microphones. Your participants, please mute your microphones.
Okay, sorry. Now, with regard to this active targeting, one of the major, problem is we have to identify a receptor. See, we first of all, if you want to target something, we have to find out what is the difference between the normal cells and this. Let us put it like, why we are talking about tumor quite regularly is that's one area where nanoparticles has got its most important use. So it could be a tumor or it could be an inflammatory sites. In these areas, generally some components of a cell are developed more for their own purpose. Maybe the cells in the tumor will develop more amount of, they will release more of VEGF, the vascular endothelial growth factor. There will be more amount of EGFR, the epidermal growth factor. So the number of receptors, because they have a huge hunger, they will develop all these receptors more. In a tumor surface, large amount of receptors are generally developed. This, number of receptors will not be present in any other, cells. So if we can target these receptors, we will be able to reach the tumor site very easily, and that's the motto, or that's the principle behind the active targeting. So we have our nanoparticle. Upon the nanoparticle, we have engineered it with a hydrophilic polymer, and also we connect it with a ligand. This ligand is nothing but it could be an antibody. It can be a monoclonal antibody, or it can be an antibody fragment, or it can be an aptamer, or it can be anything like FC, fragment crystallizable. It can be anything. Once that ligand is attached, so they will be able to go to the place, and the receptors that are present in the tumor will be able to complement it and take them immediately, like a lock and key enzyme mechanism that we know. So that's what happens between the receptors that are present on the tumor and this ligand. So we have the very important aspect here is we have to choose the receptor and we have to choose the ligand. So once we can do that, then our nanoparticle will be able to reach the site much easily and can go in. So this is what diagrammatically I have shown. This is a tumor site. You can see, the receptors, if it's non-targeted, it just goes, everywhere. But once an aptamer is targeted, so once a ligand is targeted, it exactly goes only to the tumor. So normal cells, you see that it doesn't happen. These small are nanoparticles which are not targeted. So they are going even to the normal cells. Whereas nanoparticles which are coated with this aptamers or ligands, they will go only to the tumor. You don't see this kind of structures anywhere in the healthy tissue. So the biggest problem with the anti-tumor drugs is that they are unable to select which cells are ours, because tumor cells are also our own cells. They will not be able to identify which is good and which is tumor. Whereas once they are actively targeted, they will be able to identify and go to that particular place, because the receptors are prevalent only there in a larger quantity. Maybe there are other regions also where these receptors are present, and that's the reason we'll have a little side effect with regard to the anti-tumor drugs. But once you design them very properly, they can identify and go to the spot very perfectly. So a number of mechanisms are actually used. Okay, let me not go into these details. It's going to take time. So antibody targeted nanocarriers. So for ligands, we can actually use the antibodies, immunoglobulins, or we can use the antibody fragments, or we can use single chain fragment variables. All these are antibodies, and we can also see that in the tumor we will have the antigens. So these antigens and antibodies will be able to identify each other. So that's how antibody targeted nanocarriers were very, very successful, and many researchers have found that they are much efficient. But there is one more problem, because these antibodies are produced from another animal, and as a result, it may have, once it is developed in another animal and it is injected into our body, they may lose their selectivity. So that is one problem. For that problem, we have come out with a solution in terms of aptamers. What are these aptamers? Is that aptamers are actually, they are very short single-stranded DNA or RNA oligonucleotides, and they can be even a peptide sequence. And these aptamers are actually produced by a process called a SELEX. The SELEX is nothing but systematic evolution of ligands by exponential enrichment. That's the full form of SELEX. So by this process, we actually synthesize and chemically produce these aptamers. Once chemically produced, they can be reproduced again and again very easily, and they are less immunogenic in nature. Since they are not produced in the animal body, they don't produce any immunogenic properties as that of antibodies. So if you are using antibodies, there are immunogenicity problems, but with regard to aptamers, those problems are also avoided. And this kind of aptamer conjugated nanoparticles, they are being very well used in biosensors, diagnosis, therapy, and they have been found to be very effective, and number of researchers have come out of it. Similarly, a very commonly used ligand is the folate, which is nothing but vitamin B, as we all know, and it's a glycosyl phosphatidyl inositol. So these folate receptors are very highly prevalent in tumor cells, and that's why we select folate as our ligand. Once the folate is connected to our nanoparticle, it can very well reach the folate receptors, which are highly present in all types of cancers. You call it as ovarian, breast cancer, or prostate cancer, brain tumor. In all these areas, folate receptors are highly found, and once you can take this folic acid and attach it to your nanoparticle, they can very well go in and reach the tumor site. Similarly, transference and tripeptides, these can also be used for targeting. So those are the different mechanisms by which we can do the active targeting process. But there are other mechanisms, other ligands also available, since that will not allow us to, our time will not allow us to go further into that. So I will just put it here. And I would also talk about exocytosis. Many of them would have a question whether nanoparticles are toxic or not. It all depends upon whether their nanoparticle is removed from the cells again or not. After delivery of the drug or fragments of your nanoparticles has to come out. This exocytosis is the process by which it actually takes place. So this exocytosis process actually may take place even by diffusion process, and diffusion process, as we all know, it is concentration dependent. But this diffusion process can take place only in cases where the nanoparticle is much less than 4 nanometers. If it is larger, then it has to take mechanisms like lysosomal or Golgi apparatus, or it can be directly released into the cytoplasm. So that's how the nanoparticle actually come out of it. Okay, and right, so that's what is explained here. Whatever I told you. So now I would just Amula, can I take another 5 minutes if I'm?
Yes, sir, you can.
So now probably I'm concluding, though I may not have much time to explain the illustrations that I had, but let me tell you very simply. Supposing if you are planning to design a nanoparticle, considering all these biological events that are taking place within the our physiological system, starting from opsonization or phagocytosis process, or method of endocytosis or exocytosis. If you consider all this, what should be my method of preparation of nanoparticles? If you ask that question, there are 3 important characteristics that you have to look upon. The first one being the particle size. As I already told you, anything that is less than 10 nanometers or 6 nanometers, they will be easily cleared by the renal filtration process. They don't come to the circulation. Immediately from the blood circulation, it will be removed by your kidneys. So anything less than 10 nanometers are not going to give us any benefits. Supposing if you are making it greater than 600 nanometers, they are 500 nanometers, even 400 nanometers, they will be easily engulfed by the reticuloendothelial cells. Even you coat it with PEG, it doesn't help much if the nanoparticle size is bigger. So they will be immediately removed by your macrophages or phagocytes. So the optimum size, suppose if you are planning to create or make a nanoparticle to do the passive targeting, then design something that is somewhere in the range of 200 to 300. They will be able to diffuse through the tumor interstitium, and they will stay there for a longer duration, and they will give the therapeutic benefit that you want. And supposing if you are planning to do an active targeting, I mean, try to chemically bond your ligand to a molecule like PEG, and that PEG should be, I mean, chemically coupled physiological environment, and they will be able to circulate in the blood for a longer duration. They will reach the tumor site, and by using EPR, they will, I mean, escape the fenestration, and they will stay in the reach the tumor mechanism, I mean, tumor cells by selective engulfment by the receptors present in the tumor. So size is a very, very important factor. I mean, once you design the nanoparticle for tumor or inflammatory conditions. And the second one is surface charge. Though I haven't discussed that in detail, many a times the surface charge is important. We generally develop nanoparticles, and we look upon a a charge of somewhere around -30 or +30 in order to keep them free from agglomeration, which is a physical stability. But if you are making a nanoparticle which has got a charge of about +30, which is highly cationic, and -30 highly anionic in nature, then what happens? This high charge generally triggers the opsonization process. Okay, generally anything very positive will interact with the endocytosis very easily. So it helps sometimes once during the entry of tumor cells. But I mean, anything that has got a high charge will call for opsonization process. So as much as possible, it is good to have a water-like, nanoparticles, which means the surface should be covered with hydrophilic structures, hydrophilic polymers. So the third and the most important one is try to keep the, charge neutral as much as possible. Only in cases where you want to develop cationic or anionic, develop the charges. And finally, the surface characteristics. If you want to escape the phagocytosis process, you have to escape opsonization process. And if you want to escape the opsonization process, then you have to coat your nanoparticle with hydrophilic polymers like PEG or polaxamol. PEG has got low immunogenicity. PEG has got ability to repel the opsonization process. There are many factors that will affect the pegylation, maybe something like molecular weight, the chain, branched or unbranched chain of PEG, or there are factors like the pinning density. There are factors like what kind of a structure it is present, whether it is a brush structure or mushroom-like structure. So how it is coated, all these are going to affect the surface characteristics. Again, to talk only about the surface characterization or surface, designing of nanoparticles using PEG itself is a separate topic that has to be spoken for at least 2 hours. Probably in another instance we can do that. So despite all this, let us not consider that nanoparticles are something very away from the clinical usage. That's a old story. But a number of nanoparticulate drug delivery system has already been approved by the FDA, and many of them are put into use, and they are functioning exceptionally well, overcoming all the disadvantages of conventional drug delivery systems. So I have put in all this as categories like liposomal nanoparticles, polymeric nanoparticles. You call it call it like PEG conjugates, or it can be even nanocrystals. So all these drugs are already in the market, and they are exceptionally giving the therapeutic benefits to the patients. If one important thing that I would like to put upon, many a times in an academic research, we generally find it very difficult to do nanoparticles because of the evaluation that we need to undertake, the kind of characterizations that we need to make. But nevertheless, it's most possible to do nanoparticles, possible to do the nanoparticles in the way that I was discussing all this time, with very specific surface characteristics and size. It's all possible. The most important thing that we need to have is not the polymer, not the instruments. It's a desire that we need to have, so that we can develop a nanoparticle in our own laboratory, slowly build the infrastructure that is required. Few characterization has to be made outside or beyond your capacities. So, but yet I mean, we can very well design them, and we had been successful in doing such nanoparticles in our laboratory. So hopefully, I mean, it is possible for every others. So with that note, I thank, I mean, everyone, because though I just wanted to give another illustration of our entire work that we designed for passive targeting, since its time is beyond the limits, so I'm just stopping here, and over to the organizers. Thank you once again.
Thank you so much, sir. It was an enlightening session on nanoparticles and an excellent PPT. You gave us new insights, sir. Your wisdom always resonates deeply with us. We were so engaged during your talk that we didn't even notice the time passing. Thank you for such an inspiring session, sir. And we are very grateful for your time and contribution to this program despite your busy schedule. Thank you so much.
I would like to know the feedback of the participants, because I consider you being my, I mean, old student. Probably, I mean, you are very positive. But if at all possible, kindly give the feedback of the, I mean, guests who have.
Yes, sir. We are receiving the positive responses. A very good feedback. We are already receiving it, sir.
I always believe in improving myself. I don't think I'm the best at the work. I always try to improve. And once again, I would like to thank organizers Dr. Chandrasekhar, Mrs. Amulya, and Principal Sir himself for giving this opportunity. You shifted the date for myself. I don't know if I have done enough justice on that. So in another instance, if I get an opportunity, I would like to talk about more on this topic in more elaborate manner. Thank you once again.
Thank you so much, sir. Before we conclude, I would like to invite our respected HOD, sir, Dr. NBV Sivaram, sir, to deliver the oath of thanks. Sir, Sivaram, sir. Sivaram, sir.
Yeah. Hello. Okay, before we go to the vote of thanks, I really appreciate the talk of Dr. Nandakumar for the very elaborate, detailed information on the nanotechnology. Really appreciate it, Dr. Nandakumar, sir. Now we'll go back to the end of the session, and now the vote of thanks goes. I would like to thank all the patrons of the CRR educational institutions for giving support for conducting this FDP program. And my special sincere thanks to our principal, sir, Dr. A. Narendra, for accepting to conduct this FDP program. And on the important note of this FDP program, I would like to give my special thanks to all the speakers, Dr. Sunil Kumar from Vishnu College, S. Nandakumar from MGR Educational and Research Institute, Chennai, and Dr. Damodaran from SRM Institute of Science and Technology, and Dr. Pamal Reddy from Nirmala College, Dr. Anil Kumar Adimolapu from the Assam Kaziranga University, and Dr. Varsha Tiwari from Amity University, and Dr. A. Prasanna from Sri Venkateshwara Pharmacy College of Pharmacy. I really thank all of you for coming forward to deliver your talks on this FDP program and making this one as a fruitful session to all the pharmacy fraternity. On the outset, I would like to give my special appreciation to my program coordinators, Mr. Chandrasekhar and Mrs. Amulya Madam, for organizing this FDP program. And also I appreciate the other staff members of the Pharmaceutics Department for giving their cooperation, making this FDP program a very vital one. And also thank all the other staff members of CRR College of Pharmaceutical Sciences for giving supporting hand in making this FDP program a grand success. And I also thank the special thanks to all the pharmacy fraternity joining from various colleges and institutions for making this FDP program a very, very wonderful session. Hopefully, we will conduct much more fruitful FDP sessions in future, bringing more people to enlighten or to make our knowledges in the pharmaceutics area a very vital component. So I thank one and all for this FDP program. So have a good day and get back to Amulya Madam for the final note.
Thank you, Sivaram, sir. And with Navratri just around the corner, beginning on the 3rd of this month, I would like to wish everyone a very happy Navratri in advance. Dear participants, your participation certificates will be sent to your emails within a week. Thank you all once again, and I hope to meet you soon in future programs. Have a wonderful day and a joyous Navratri ahead. Thank you all.
Same to you, ma'am.
Thank you all.
Same to you, ma'am.
Thank you, ma'am. Thank you. Happy Navratri.
Happy Navratri, ma'am.